they found him dead in a motel room with an empty bottle of Percocet and an empty quart of vodka. 52 years old. He had everything. He's a drug addict, and he couldn't get help, and he's dead. It can happen to anyone. And so we need to start treating people in this country, not jailing them.
New Jersey Governor Chris Christie in a candid interview discussing the death of a close friend due to prescription drug abuse. This comes as a new report reveals middle-aged whites in the U.S. are dying at a startling rate, likely because of problems with both legal and illegal drugs. For more, we welcome to the anchor desk Dr. Lisa Palmer, family therapist at the Renew Center of Florida, and also with us Newsmax Health editor Nick Tate. Nick, of course, the author of Da Vinci's Baby Boomer Survival Guide. And we're pleased to have you both here on Newsmax Prime. Lisa, how often do you hear stories like the one just proffered there by Governor Christie?
Every day. I mean, I'm in the field of treating addictions, so it's very common for me to hear about it. Absolutely.
Is this a growing problem in your opinion?
Absolutely, because people are not only using illegal drugs to self-medicate, but they're using prescription drugs to do it as well. And it's becoming a real problem with people using painkillers. For instance, sometimes they're being used to treat a real problem, pain in the body, but then they're actually being used to treat something that's psychological.
Nick, we take a look at this demographically. People in middle age, I mean, we tend to think about kids getting into this, at least in the era in which we grew up.
Right.
Why is it changed demographically?
Well, it is curious because in other age groups, older and younger, minorities and other groups of people, we've seen the death rate decline. In most other countries, we've seen the death rate decline, wealthy nations. So for white middle-aged folks to be having this spike in the death rate really is curious. It does speak to, as the doctor suggests, that there are a growing number of people that are dealing with addiction, probably much of those addictions are to pain medications that are prescription pain medications. An increasing number of people are living with chronic conditions that cause pain. They turn to medications, and they're very easily, they can very easily become addicted. But it's also alcohol abuse, so it really speaks to the number of folks that I think could benefit from better mental health care. And for me, and I wonder your opinion about this, doctor, does this not point up a gap and maybe a lack in how we are treating folks with stress-related mental health conditions, biological mental health conditions? And the drugs really mask that problem, don't they?
Absolutely. As far as the drugs are concerned, people don't think about the side effects of the drugs. Oftentimes we see the commercials and the person's running through the fields and they're so happy, and then you hear at the end it can cause this and that. So these drugs, because of the chemicals and the fillers, do have side effects for people, and people are not getting to the root cause of their problems, so the drugs are kind of, for them, masking it. So it is a real problem, and people do need to change their lifestyle and get more balance in their life and really get to the root cause of the problems.
Dr. Lisa, you're talking about this. Nick brought up the kind of mixing of alcohol with whether prescription drugs or illicit drugs. Are there warning signs that should be apparent to loved ones? What should we be looking for?
Well, first of all, I'm so glad that this is being brought up, because oftentimes psychiatrists are not even asking their patients, hey, you know, are you drinking while you're taking these medications? It's a big problem. You know, when we understand chemistry, we understand how dangerous it is, really, for someone to be mixing a psychotropic medication with alcohol. So people really need to stop that and really look at what the side effects are. And what was your...
Well, I'm wondering, too, the warning signs. Are there things, personality changes, some sort of physical manifestation that family members might see?
Well, depending on what it is that you're taking, you know, and what's going on, there are going to be some different types of side effects, of course. But oftentimes we see people with insomnia. We see exacerbations of anxiety, exacerbations of depression, sometimes suicidal ideation, sometimes homicidal ideation, aggressiveness. It really is going to depend on what's going on, but those are some some common side effects.
Nick, it has seemed over the last 20 years, we've seen a lot, really a new field in medicine dealing with pain, whether it is physical pain from disease, mental and psychological pain. 20 seconds, can we expect to see the growth of that discipline more in terms of medical treatment?
Sure, where there's money to be made, there's going to be growth, and that's the case. You know, it also coincided with a very difficult economic period that put a lot of stresses on folks. There are some laws I'll mention in some states where they track this kind of people who doctor shop, who look for different doctors that will give them multiple prescriptions. Some of the states are cracking down. Maybe as part of healthcare reform, we should be looking at those kinds of medical practices too to control the problem.
Good point, and that's where we'll have to end it.
Absolutely.
Dr. Lisa Palmer, we thank you for your time. And
Thanks
Nick
for
Tate,
having
of
me.
course, co-author of the Baby Boomer Survival Guide. You want to get more information on this? You can go to babyboomers711.com to find out more. And we'll continue after this.